cause more harm in the community.
Question number 11, the Honourable Annette King.
Thank you, Mr Speaker. My question to the Minister of Health. Does he agree that every person can afford health care and disability support regardless of their income, health status or risk profile?
Honourable Tony Ryle.
Mr Speaker, in New Zealand we heavily subsidise primary care and have free hospital care, but for some New Zealanders cost can be an issue, and that's the reason why we have a welfare system. For example, while prescription charges have gone up by $2 an item with a 20-item cap, those who have difficulty in meeting this cost can discuss their circumstances with their GP and pharmacist, or they can go to WINS.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable
Well,
Annette
in light
King.
of that answer, is he concerned with reports in the Dominion Post on Monday where pharmacists are saying that people are not collecting their prescriptions, are taking only a few days of medication at a time, choosing some drugs over others because of the increase in prescription fees, and health professionals are now saying that it's the poorer patients who are suffering? If not, why not?
Honourable Tony Ryle.
Mr Speaker, I'd have to say that some people not picking up their medications for cost and other reasons is not new, but the government has made it very clear that people will be able to qualify for a pharmaceutical subsidy card after reaching 20 prescription items in a year, which means that no family need pay more than an extra $40 a year as a result of the co-payment. If they do have any troubles, they can go to Work and Income New Zealand, and it is the use of the pharmaceutical subsidy card means that about a third of prescriptions filled in New Zealand are filled without any co-payment.
Supplementary question,
Supplementary
Mr. Speaker.
question, the Honourable Annette King.
Well, in light of that answer, if it's all okay, why did the Ministry of Health hold a meeting with a number of stakeholders in the past month where the Ministry expressed concern at the growing number of people unable to afford to pick up their prescriptions because of the increased costs, and asked the stakeholders to help them find a solution because, quote, it could become an election issue?
Honourable Tony Ryle.
Mr Speaker, I'd have to, I'm unaware of that meeting. I'd have to check the facts. It could be like the member's claim about the Timaru Hospital's various reports with doctored OIAs, and because I'm unaware of that and it's not verifiable, I can't comment.
Well, I'll verify it later.
Order.
Supplementary question,
the Honourable Annette King.
Well, how does he decide how serious a problem is, especially for poorer, older New Zealanders, when he has informed me that he does not receive any regular reports from any entity on the impact on patients of his increased prescription charges, when he dismisses the concerns of health professionals, and when his own ministry is too scared to tell him they're worried about the growing impact of the hiked fees on patients?
Honourable Tony Ryle.
Mr Speaker, if this was, and for some people it's difficult, and that is the reason why Work and Income is able to support those people. It's the reason why we have the prescription subsidy card. But what I can report to the member is actually the number of prescriptions being filled in New Zealand, according to all the data that I've got, is actually increasing. And the amount of money that we've made available for pharmacy is also increasing.
Supplementary question, Mr.
Supplementary
Speaker.
question, Honourable Annette
Is
King.
he aware hundreds of thousands of New Zealanders who are eligible for an exemption card from the prescription charge miss out because they don't get their prescriptions filled at the same pharmacy? If so, will he support my solution? A pharmacy card which is able to be used in any pharmacy and records all prescriptions dispensed, ensuring when a patient does reach the 20 script limit, they get the exemption they're entitled to. If not, why not?
Order. Honourable Tony Ryle.
Mr Speaker, I am aware that each year more than 750,000 people use the pharmaceutical subsidy card to maintain their medicines, and the government is working on a number of options related to new electronic support in pharmacy, which will facilitate people having easier access to the issues that the member raises. But I would say to the member, it would be helpful if anybody that she meets who is having trouble with their pharmaceutical costs, that she does advise them that they are able to contact WINS for support.
Supplementary question,
Supplementary
Mr. Speaker.
question, Honourable Annette King.
Does he recall saying that pharmacists play an important role in primary health care? And if so, why doesn't he listen to their experiences of the impact of the increased prescription fees, which have not only led to problems for patients, but also for pharmacists themselves, who say they are now carrying greater debt, that they're throwing away hundreds of thousands of dollars of medication and are providing prescriptions on a drip-feed basis?
Honourable Tony
Mr.
Wild.
Speaker, because I think the feedback from pharmacy isn't necessarily as is represented by that member. I think that it is, many people are talking about, many pharmacists will tell you there's not been much of a change in their area. Others are having difficulty, and those people who do experience difficulty in meeting pharmaceutical charges should contact Work and Income for support. What I can advise is this government continues to invest very strongly in pharmacy services and in the health service as a whole. Record funding, $500 million a year extra on average under the National
Point of order, Mr. Speaker.
Point of order, the Honourable Annette King.
Mr. Speaker, I seek leave to table a letter to me received on the 12th of August 2013 from Tony Rao, stating that he does not receive regular reports on the impact on patients of the increase in prescription fees to $5 from any entity.
Order. Leave is sought to table that particular letter from the Minister to the Honourable Annette King. Is there any objection? Appears to be none. It can be tabled. Order. Question number 12, Mike Sabin.
Thank you, sir. My